Hey, good afternoon, family. This your boy Eric Priority Mail. It is a fabulous Friday, and it's also Friday the 13th. For all my superstitious followers, just know that I don't believe in superstitions. However, do believe in if you don't do what you need to do, you ain't gonna get the results that you're seeking. Okay? So, on this fabulous Friday, I've been talking a lot about prostate cancer. I've been on basically the Chitlin circuit here in the city of Houston talking about prostate cancer awareness because this is Prostate Cancer Awareness Month and I'm trying to get the word out. I've been in this game 22 years. As a nurse, I've been a nurse practitioner for the last 11 years, and I've seen a lot in that time. Okay? And I've been just trying to make sure I share this information. Don't just sit on this information, but share it with people that I know could benefit from it. So I've been doing a lot of posts this month on prostate cancer, and I must say that the posts have generated a lot of dialogue and conversation with a lot of the men that follow me and some of the ladies. And I'm glad because that was my intention. Okay. One question that came up a lot is basically how do you engage with your physician, your medical professional, whether it's a doctor, nurse practitioner, physician assistant. And I wanted to share some information here today on some questions you should ask your doctor. Now, pay attention to the shirt I got on here today. It says, "Trust me, I have a beard." So, everything that I'm about to say here today, charge it to the beard. Okay? It's legit. It's legit. All right, so I wrote a list because I want to make sure I don't miss anything, okay? Now, again, a lot of questions have been asked, but this question has come up a lot. What do I ask my doctor? Okay? Now, first of all, you need to be engaged and involved in your healthcare, such as you are with other things in your life. Some of us spend so much time on social media, on YouTube, and just entertaining stuff that does nothing for us. I mean, nothing at all. Okay? So, the time and energy you put into all that other stuff, take it and focus on yourself. Okay? Put that energy into you. All right? And I think what I want you to focus on, don't worry about others. Focus on you. Okay? And that's the problem in this world today. We focus on what other folks think. Man, I don't give a damn what nobody think about me. I'm sorry. I'm focusing on me, my family, and my close circle of friends and those that have influence on my life. Outside of that, if I don't know you, I don't even care what you think. And we should get there. We got to get there, y'all. But I want you to focus that time and energy on you. Be engaged, be involved, speak up, and advocate for yourself. So, if you're going to a doctor, if this is your first time to the doctor, this is what you need to do. If you're on any current medications, please bring a list of those medications if you can't bring the bottles. So we know the actual medication, the dose, and when it was last prescribed. Also, if there are any allergies, do you have any allergies to medication? Some people are allergic to penicillin, some are allergic to Bactrim, and other known drugs out there. So we don't want to knowingly prescribe or unknowingly prescribe a medication to you that could cause you harm or an adverse drug effect or adverse drug reaction, however you want to look at that. Okay. And if you know your past medical history, please be able to articulate that or bring someone along with you that can do that. For most men, your wife, she's going to know what's going on. Okay. You call your personal secretary, whatever you want to call it. But hey, our wives are there for a reason. And some of us can't survive without them because they know what's going on. So if you know you can't quite tell the doctor what's going on, bring your helpmate along, man. Okay, she gonna drop it. She gonna let us know what the deal is so we can get straight to the point. Cause you know me, we don't like to do all that. I'm good, doc. I'm straight. Yeah, ain't gonna talk about none of that stuff. But no, not your wife. No, he ain't, doc. He lying. He lying. I'm gonna tell you, and she gonna tell it. So please bring your wife along if you're not sure that you can clearly articulate your medical history. If you've had any labs done at a previous doctor, bring a copy of those labs so we can review those, so we can compare those with what we might be doing at this appointment. So we have a baseline of what's going on with you. Okay? The other things you should ask, if you're there for the first time, you've never had an appointment, this is your first physical, and they do some stuff on you, check blood work, Is the blood work normal? Okay. What am I at risk for, doc? What symptoms should I be looking for? Also, can you provide me a copy of that blood work? That is your medical record. You can take it and have it for your own record as well. So if you choose not to come back to that doctor, you have those labs because they're yours. It's your medical record. I advise everyone to keep a file on yourself if you can. Okay, do that. Get a copy of your labs or any imaging you've had done: CAT scan, MRI, chest X-ray, ultrasound, whatever it is. Get a copy of it. Okay, have it for your record. It is yours. So ask the doctor, what do I have? Okay. Understand what that is. Is it a condition or is it secondary to something else? Okay. Is what I'm dealing with secondary to this? And if so, what do we do to correct that? How do we manage that? Do we start medications? Do I need some kind of therapy? What diet and lifestyle modifications do I need to make to help mitigate worsening of this condition or any other secondary complications from this condition? Okay. So ask questions. Okay. And then if it's a cancer diagnosis, get to your oncologist and you want to know what's your chances? What is the prognosis with this condition? Okay. And that's a different conversation to have. And we can do that at a later time. But this is more so focusing on a routine medical office visit, primary care, physical. Okay. Next thing, again, I think we talked about labs, we talked about the medications, we talked about any imaging. Now, medications. If you're being prescribed a medication, hey, ask, can I take generics? Because some of the brand name medicines, especially if a pharmaceutical rep just came through that office, chances are they're going to try to prescribe you the newest thing on the market. And trust me, it's expensive as hell. And it may have side effects that you may experience. And we want to be careful with that. So always ask for generics. Always be cost efficient when it comes to spending your money. So, doc, if I have high blood pressure and you want to prescribe me this medicine, is there a generic form of that medicine or is there an alternative to that medication? Because, you don't know how expensive some of these medicines are. Okay. And if they give you one and give you a coupon or something to go with it, I'm going to tell you right now, that medicine is high as the Empire State Building and you need to ask for a generic. Okay. Unless that medicine is really unique to you. Medicine is changing, but it hadn't quite gotten there yet where we're to the medicines where it's just specific to a certain dynamic of people. We're not there yet, but it's coming. But the newer medicines, yes, they do work, but they're very expensive, and the older medicines work just as well. So always ask for older generic medicines if possible, unless you just need a brand medicine. Like for me, I had my thyroid removed about 2 years ago, and I was concerned whether I was going to be able to do the generic levothyroxine versus the brand levothyroxine, because some patients, in my experience, have had issues with the generic versus the brand of that particular medication. Fortunately, I was able to just take the generic form, and it's very cheap. And it works. My numbers are fine. So those are unique situations there. And you would have to have that conversation and sometimes a trial and error with your doctor and the medication. But just be open to that, okay? And know what the side effects are, your medications are, know what the precautions are. Some medications you take, you can't be in the sun for prolonged periods of time. Some medications you take, you can't drink alcohol. And that's going to ruin a lot of y'all weekends. However, make sure you ask those questions. Doc, what are the interactions? One drug I'll tell you specifically, it's an antifungal. It's called metronidazole or Flagyl. If you're prescribed that medication for a number of reasons, I ain't going to get into all the details, but if you are prescribed that medication and they don't tell you that you shouldn't consume alcohol, you heard it from me first. And trust me, I have a beard. Do not drink alcohol with metronidazole. It will give you a god-awful GI upset, okay? If you're familiar with the alcoholic treatment we used to do back in the day, a drug called antabuse. There's a drug that we used to give alcoholics to stop them from drinking, because if they took the drug and put alcohol in their system, it would basically make them puke their guts up, and they would never do that again. You have that potential side effect with metronidazole or Flagyl. So if you're not aware of that and you happen to be on that medication and you're on the weekend, a girl's trip or a guy's trip, and y'all trying to turn up, and you ain't going to turn up long because you're going to turn down soon. So be careful with that. All right. Also advocate for age-appropriate screenings. I know some of y'all follow me are what I call Googleologists. And what is a Googleologist? A Googleologist is somebody that Googles every damn thing. You know who you are. Hell, I'm guilty of it at times myself. But if you, every time you get a symptom, you go to Google, Dr. Google, because you need to check that with Dr. Google. You need to have that quick consultation with Dr. Google. Be careful with what you get on Google, because people can upload anything to the internet, y'all. And some of that stuff is the quickest way to the grave. So please be careful what you get on Dr. Google. But I will tell you this. Dr. Google does provide you with some information to scratch the surface and create an environment where you can ask more questions, okay? So I do encourage you to use Google, but I don't want you to take it as the gospel. It is the final word, okay? Medical doctors and nurse practitioners and all us PAs, we go to school, we do the training, we learn the protocols. We're there for a reason. And there's some good stuff out there, but I'm gonna tell you a lot of it is a bunch of BS. So be very careful what you find on Google. But use Google as a way to maybe start the conversation about symptoms you have or a condition you have or a concern you have, and share that with your provider, okay? And make sure you're getting, again, the age-appropriate screenings. There are certain screenings that need to happen at certain phases in our lives, okay? At age 40, in that age group, at age 50, in that age group, 60, and so forth and so on. There's certain screenings that need to be done for men and for women, and you need to have those conversations with your doctor and have them done regularly. The only way you're going to get that, though, is you see your doctor on a regular basis. You can't wait until something happens and then show up and be like, I ain't been to the doctor in 25 years and now I show up with all these symptoms. That may not be the best outcome. So seeing your doctor at least once a year or as often as indicated based on your health status is what you should do. And the last thing I want to leave y'all with on this is make sure you follow up. So many people have had good intentions to go see the doctor, get the information, start some of the treatment plan and some of the modifications with diet and lifestyle, and then they ghost us. They never come back. And then when they come back, it's years later. And some of them had the audacity to say, well, you didn't tell me I needed to come back. Yeah, they did. When you checked out, they tried to schedule that follow-up appointment. You said, nah, I'm good. I'm going to check with y'all. I'll let y'all know what's up. You know who you are. Schedule your follow-up and keep your follow-up, okay? And stay on top of your health. But I kind of hope this answers the question about what to ask your doctor. You want to ask the appropriate questions that, again, fit your situation. Everybody's going to be unique. These questions I provided are a really good starting point, and you need to have a doctor that you can relate to. You need to have a doctor that is going to listen to you and make some shared decisions with you, and you're going to meet halfway. Some doctors are old school and they just say, do as I say. They don't want to hear what you have to say. You might need to reconsider that relationship, because I'm going to tell you right now, that may not last long for you. But you also need to be open to the recommendations as well. And again, let's make a shared decision. Let's you and I sit down, talk about your concerns, and let's meet halfway based on the recommendations. Okay? And again, have a good rapport with your doctor. See them on a regular basis, and try to stay on top of your health, y'all. Okay? Good health is the best wealth you can have in this world. Okay? The richest man in the world will forego all his riches to buy back his health. Okay? My price on health and your price on health is going to be different, but it's going to be equal sacrifice, because who knows what you're willing to mortgage and what I'm willing to give up to stay healthy or to buy back my health. And I've seen many people work 40, 50 years of life, neglected their health. Now they're at the horizon in their life where the sun is starting to slowly set, and they have amassed a pretty nice retirement package, but now their health is suffering and their body won't cooperate with what their mind wants to do and their pocket is able to afford. But what really happens is they end up coming off of one job, and then their full-time job becomes going to see the doctor, seeing this specialist and that specialist, having this procedure and that procedure, a joint injection here, a surgery over here, and a copay here and a copay there, and a prescription over here and a prescription over there. And before you know it, you've been at the doctor 5 days a week. Okay? You have actually completed a residency in internal medicine because your health is so jacked up from 40, 50 years of neglecting it. And now you have time on your hands, and your time, instead of enjoying your life and spending time with your retirement money, you spending time in the doctor's office and spending your resources to buy back your health. Think about that. All right. I hope that again that's answered your questions. It's your boy Eric with Priority Mail. For all my followers, men and women alike, please send people my way. And if there's something you want to hear me talk about, let me know. I'm going to shoot it to you straight. And that's Eric at Priority Mail. That's PRYORITYMALE. I hope y'all have gotten some out of this feed today. And let me know if you have any questions or concerns. All right. I appreciate you. Have a good one, y'all. Peace.